Morning, everybody. 7 o'clock in the UK. Sleaze and unease over mandatory COVID jabs for NHS staff and a train to Glasgow to save the planet. The Prime Minister has a lot on his plate today. We'll be putting all of that to the Health Secretary Sajid Javid in just a moment. Labour's Chris Bryant, the chair of the Parliamentary Standards Committee, is also on the programme. We'll also get a picture of COVID cases around the world from the World Health Organisation's David Nabarro, of course. And he was one of the most notorious murder trials in recent history. We'll be live in South Africa to find out why the former Paralympian Oscar Pistorius could be granted parole after his conviction for killing his girlfriend, Riva Steenkamp. And more on this as well, talking to British zoo officials as scientists say COVID-19 could be spreading from humans to animals following an outbreak at Denver Zoo in the United States. With those guys. It's Wednesday, the 10th of November. No jab, no job. What next for the tens of thousands of NHS staff in England who've been told to get the COVID vaccine to work in the health service? Labour calls on the anti-Sleaze watchdog to investigate Sir Geoffrey Cox over claims he misused his parliamentary office to carry out legal work. Roadblock, climate blow for the Prime Minister as the world's two largest car manufacturers swerve a global deal to cut new car emissions by 2040.
And here in Chennai, it's red alert as the city prepares for more extreme rain, and it's already looking like this.
Duke of Sussex claims he warned the boss of Twitter that the social media giant was allowing a coup to be staged just hours before protesters stormed the US Capitol building.
I warned him that his platform was allowing a coup to be staged. That email was sent the day before, and then it happened, and I haven't heard from him since.
Wall of lava, the volcanic eruption in La Palma, continues its destruction of thousands of acres of land. Good morning, everybody. There's a lot on the Prime Minister's plate this morning. The fallout over the news that frontline NHS staff will have to get a COVID jab to keep their job from April. Plus, reports now of Labour calling for an investigation over claims the former Cabinet Minister, Sir Geoffrey Cox, broke the rules by using his parliamentary office for his second job, offering legal advice. All that as he's preparing to dash to Glasgow today to pull out all the stops, he says, to save the planet. We'll be joined by the Health Secretary Sajid Javid in just a moment. First, let's take you through how this morning's newspapers are covering the news on COVID vaccines. Here we go, starting with the Mirror, saying around 100,000 NHS staff face losing their jobs unless they get fully vaccinated by April. The Eye warns care homes in Birmingham, Manchester and also Nottingham could see staff shortages when mandatory vaccinations are introduced because uptake among the profession in those areas is low. The Express also lead with the Health Secretary's ultimatum to healthcare workers, adding 73,000 could quit over the plans. Speaking to the Health Secretary about all of that in just a second, not just the Prime Minister with a lot on his plate today.
No, the no jab, no job policy has been thought about for some time. There's been a long consultation that the government have held, and Sajid Javid said that there were strong arguments on both sides, but he told MPs in the Commons yesterday that the balance tips to one side, which is that protecting patients who are in hospital from COVID is the priority, and therefore those staff who do not get vaccinated will be redeployed or asked to leave if they are on the NHS front line working with patients. Now, mindful that the winter is the most pressurised period for the health service, he intends to bring this in from the 1st of April next year. So there are some months to go, and of course it will have to be voted on in Parliament, where Labour do not support it, and I expect there will be some Conservative opposition as well. So there are some months to go, but of course the policy for care home staff to have mandatory vaccinations comes in tomorrow. We know that something like 32,000 care home staff have not been vaccinated, and many of them have already been asked to leave their jobs.
And as far as the PM is concerned, loaned his lesson, no private jets up to Glasgow today for him.
Yes, he is in Glasgow a bit earlier than expected today. He'll be getting the train back, unlike last time. Why is he there? Because A deal needs to be reached by the end of this week. This is the crunch period where the negotiators are speaking to their political leaders, so especially those countries like China who haven't sent their president. Those negotiating teams will be speaking to the politicians back home about what their commitments are going to be. And Boris Johnson says this isn't about any one country, this is about everybody making the commitments now, because of course the whole point of this summit is to try and limit global temperature rises to 1.5 degrees by the end of this century. But we heard yesterday from climate scientists that we're well off track, might even reach 2.5 degrees by the end of the century. So the Prime Minister wants to get some more commitments by the end of the week to prevent this, a good deal at this summit, really slipping through his fingers.
Yeah, and we're not really sure at this stage whether it's going to go on for an extra day or not. It certainly will if it means that there might be a deal in the offing.
It almost always at these summits, I've been to 2 of them before, ends up being middle of the night on the day after what was supposed to be on the last day. But we understand a draft deal has just been published today by the UN, and then all the countries will be looking at that with a view to doing some more wrangling before the end.
OK, tomorrow I know you're going to chat to us again once we've heard from Sajid Javid. We're looking for him, not sure where he is. We'll find him.
Hope you find him.
See you shortly. Thanks very much indeed. While we're looking for the Health Secretary, let me tell you what the Prime Minister is up to, heading to Scotland, as we heard there, from tomorrow. It's been revealed some of the world's largest car manufacturers won't be signing a global deal to phase out petrol and diesel cars. How interesting. Today, ministers from 24 countries and car manufacturers, including Ford, Mercedes and Volvo, are expected to commit to 100% zero emissions new cars and van sales by 2040. But the world's 2 largest manufacturers, that's Volkswagen and Toyota, they are among those that have declined to sign up. The UK government will reaffirm its commitment to outlawing the scale and the sale of new internal combustion engine vehicles by 2030, and will also commit to making all HGVs zero emission by 2040. Well, the future of transport is the main issue being discussed at the Glasgow summit today. The US Transport Secretary has told Sky News America will do everything it can to try to reach a deal on making travel cleaner.
Knowing that transportation is the single biggest sector in our economy creating greenhouse gas emissions, we view that as a challenge and an obligation and an opportunity to be a big part of the solution. On the surface side, that means everything from deploying more electric vehicles and electric vehicle chargers to making sure that active transportation in our cities and small communities is supported, but also with the historic legislation that just passed our Congress, a level of investment in public transit like we've never done as a country before.
Ashna's with us now up at COP26 in Glasgow. We're looking everywhere for that minister. We've no idea where he is, but we'll find him, Ashna. In the meantime, bad news about Toyota, and is it Volkswagen as well?
Yeah, that's right, Kay. So, the government's meant to be announcing a huge new emissions deal today, all about electric cars, all about the future of heavy goods vehicles being electric for the next in the next couple of decades. But there have been some 2 big car manufacturers, some of the largest manufacturers, who have refused to sign this deal. It's meant to be the case that it could come into force in 2035, maybe even 2040s. But it looks as though Volkswagen and Toyota, the world's 2 largest manufacturers, are among those that have declined to sign this new Route Zero pledge, which is due to be announced later today by the Prime Minister. As Tamara was saying, it is a huge deal for negotiators today, but also delegates as well, as the Prime Minister of the UK comes to COP. This is a real moment. This is about adding a political heavyweight into all these negotiations. As Tamara was saying, a lot of these countries have spent the last few days now debating with each other, negotiating terms of this new pledge, new contract, this new agreement that we might get by the end of the week. But it could well be that they now have to go on the phone, physically pick up the phone and convince their leaders that this might be a good way to go down. And the point of the Prime Minister being here today is to encourage more ambition, more ambitious pledges from these nations who might be a little bit reticent about movement on where to go, but it all comes as analysts and scientists are predicting that the pledges and the commitments made so far would only get us so far. It's only going to get us to 2.4 degrees of world warming, and that's a huge limit. That would mean so much more extreme weather, and what we want to do is limit it to 1.5 degrees. So it's hoped that this injection of this political heft we'll get some more movement on new pledges. And as Tamara touched on, we might well be seeing a first draft of this communique by the United Nations today.
OK, thanks so much indeed. Katerina is actually in Chennai for us, talking of extreme weather. Good morning to you, Katerina. My goodness, that floodwater's not gone down much, has it, if at all?
No, it hasn't, and in fact it has continued to rise. We've had a very heavy bout of rain in the last hour or so, and I don't know if you can see behind me, we arrived at this road maybe an hour and a half ago and it's gone up at least 2 inches. It's now a case of really preparing for what more might come down. We're hearing there is going to be a forecast, or there is a forecast of more extreme rain today and tomorrow. We've just been speaking with these guys here and they tell us at their restaurant here, wow, I mean, you can see it's already moments from looking like it's getting underneath that barrier. They tell us actually inside there's already rain in there. People clawing to get their vehicles on any bit of higher ground. We've seen people that live in this residential neighbourhood, they've already been moving their vehicles. It looks like the person that owns this car doesn't have long to move before that gets flooded. This rain started on Sunday when 20 centimetres fell within an hour, and low-lying parts of the city, like we're in now, have struggled to shift it. There's been so much building over the last 10 years, and there has been a lot of anger towards state ministers that they've not done enough since the last time Chennai flooded, which was about 5 years ago, to make it more resilient to extreme weather, to extreme rainfall, so that when there is unprecedented volumes of rain, like we had on Sunday, like we're expecting later on today and Thursday, they don't have to do things like this, put in road barriers so that people can't get down roads that are now totally waterlogged. There's pumping going on. There are emergency teams in some part of the city and the greater suburb that are already looking at evacuating people out of their houses. We know from Sunday's flooding that there were many neighbourhoods where homes were totally inundated. And this is the problem. Look, even in that short walk we've done, the water level changes so quickly. So one house can be dry, but a neighbour's house might not be. And that is the difficulty for teams as they're going around trying to assess what to do, who to help first, because this is a city of 20 million people and everyone is preparing for the worst. I'm just going to take you, sorry, it's quite slow going, wading through this water, it's quite challenging. I'm going to take you to the main road because, as you can see, there are still people trying to get through this flooding. Schools have been shut for the past 2 days, they're shut again today, they'll be closed again tomorrow. But government offices also shut, but private businesses are still trying to get through. Look at how many people are still out on the road. We've seen people trying to move their vehicles to get them onto some sort of higher ground. Obviously, we don't know if that's the case here. People have been advised to stay off the roads. It's just too dangerous when they don't know exactly what's underneath. They can't see what's in front of them, and the waterlogging is making it very, very difficult for anyone to get anywhere. There are, of course, many concerns about safety of people in their homes. In this part of the town, this is one of the wealthiest neighbourhoods in Chennai. Most of the houses you see here are, well, they're actually apartment blocks, so people are elevated, they're higher up. But towards the outskirts, people are living more in bungalows, in small houses that are much more prone to this sort of severe flooding. And as I said, those rescue teams, they're going out, they're doing recce's, they're assessing now, because this isn't the worst of it. Everyone is preparing for much more intense rain. Wednesday and Thursday, people are trying to rescue what they can from their homes, get their vehicles onto higher ground. And as we saw, businesses are already shutting up. But really, you look around you, there's no sandbags, there's no protection for businesses. There's really nothing to stop the water coming in if it comes down as is forecast and it continues to rise like we're seeing it. And as the guy we were speaking to over there said to us, it's just more money he has to spend. It makes people, obviously the business is shut, they're losing money through that. They just want there to be a better plan and more resilience so that when there is extreme rainfall like this, the city is just better able to cope.
Serena, just before I let you go, I mean, it is rainwater that you're talking about, but it's causing problems with the sewage system as well. People are walking around in this. They're not going to be very well, are they?
Yeah. No, absolutely not. After so many days of this area being flooded, it's what now, nearly 72 hours, the rainwater's mixed with drain water, inevitably, and it's very unpleasant. It smells really bad, and as you say, you know, we're here in our protective rain gear, but just spin around, Dean, just spin around there. You know, there are guys still in tuk-tuks, these sort of moped vehicles. They're wearing sandals. The water's not far from going into vehicles like this, and as you say, whenever there is flooding of this sort of level, it brings disease, it brings so many issues. Obviously, in some parts of the town, in some parts of the city, we're told that power has already been cut off, so that if there are any loose wires that are dangling into this water, it doesn't cause any safety concerns. But of course, this is an enormous city. It's one of the biggest in India. How can you ensure that everywhere is going to be safe? It's exceptionally difficult. It's very, very challenging. There's been a lot of criticism already for the State Ministry, as I say, for not better preparing. You know, they've had instances like this before. Yes, the volume of rain that fell on Sunday is unprecedented. It's not usual, but still, they are used to monsoon rain. It's a city that is used to flooding. It needs the monsoon rain to make sure that farmers can guarantee a crop for the next year. But what they need to do is find that balance between, you know, rain which is helpful and then rain which just does this. I mean, it's really incredible, I think, when you see people still trying to move through it, but it's going to get to a point where the city simply grinds to a halt if they continue to see rain fall like it has over, as it fell on Sunday and as they're predicting it to fall today and tomorrow.
OK, lovely. Thanks very much indeed for the update. Keep well, Katerina. Thank you, especially with that horrible, dirty water that you're wading through there. Thanks a lot. One of my old bosses always used to say to me, viewers will forgive you anything as long as you're honest with them. In the interest of full transparency, we think Sajid Javid got lost, but we think we know where he is, and we think he's going to be on the programme in a minute or two. So stay tuned for more on that. He's up at COP26 in Glasgow. Also still to come, Dr. David Nabarro will be with us from the World Health Organization. He's giving us his very latest assessment of the global fight against COVID-19. And for the latest on the fight against flu and COVID-19 in the UK, we'll chat with Dr. David Lloyd, our regular GP, of course. And more than 250,000 Afghan refugees have now fled to Iran. We'll talk to the Secretary-General of the Norwegian Refugee Council, Jan Egeland, live from Tehran very shortly. Latest on the COVID data for you, the UK has recorded 33,117 new cases. There have been, sadly, 262 new deaths, bringing the total number of deaths reported within 28 days of a positive test to more than 142,000. 33,559 people received their first dose of a vaccine in the last day, while the number of people receiving their second dose was 20,000. Almost 46 million people have now had 2 doses of the vaccine. We found him. He's here. Hello, Health Secretary.
Hi there. Good morning. Lovely to join you from Glasgow.
Excellent. We lost you, but thankfully you're with us now, which is great. Talk to us about compulsory jabs.
I was trying to find my way around.
Well, I'm glad that you found us now. We were waiting for you. We'll always make room for you, sir. Compulsory jabs for NHS staff. Why?
Because, first of all, let me just thank the NHS and care staff for the amazing work they do, but especially those that have already chosen to take that vaccine. And they've done that not only to protect themselves and their colleagues, but most of all, they've taken it to protect their patients. And that's why. That's really at the heart of this. This is about patient safety. We know that the vaccines work. We also know that patients in hospital, in care, these are some of the most vulnerable people in our society. And if they are exposed to COVID, it could be fatal. And I think it's our duty to make sure that they are as safe as they can be. And that's why I announced this yesterday, so that from April next year, that if you work in NHS or care, you will be required to be vaccinated. And I want this to be a positive decision for everyone and to work with them. There will be absolutely no scapegoating, no singling out, no shaming, but working with colleagues to support them in every way that we can to help them make this positive decision so they can protect themselves, their colleagues, and most of all, their patients.
Yeah, but should they lose their job if they don't want to?
I don't want to see anyone lose their job. I don't want to see anyone have to walk away from their job. But I think that what we all do want to see, we want to see our hospitals, people providing care, whether it's in your home or in our care home, and we want those patients, those people to be as safe as possible. And now with what we know about this horrid virus, and but also the fact that the vaccines work, I just do think it is important to be doing everything we can. Because also what I don't want to see, most of all, what I don't want to see is someone being exposed to, that's vulnerable, being exposed to COVID when it could have been prevented, and perhaps they might even die from that, and I think that would be totally unacceptable.
So if you've been double jabbed, then you can't pass on the virus?
No, if you've been double jabbed, then you're less likely to be infected. Of course, you can still get infected, but you're less likely to, and we know that. So if you've had the AZ jab, for instance, that we know that from study after study, that the chances of you being infected are 65% less than they would be otherwise. With the Pfizer jab, it's about 80% less. So you're less likely to be infected. And if you are, you can only pass on the virus if you are infected, and that's why the vaccines are so important.
Yeah, but you've got a 37% chance of still passing on COVID-19 if you've got it, even if you've been double jabbed.
And, you know, this isn't about perfection. You know, there's no
That's
risk-free
not
world
perfection,
that we can...
with all due respect, Health Secretary, come on.
We don't live in a risk-free world. This virus, we're learning about it all the time, and it's our duty to make sure that we're doing everything we can, using all the tools that we have to protect people. And what yesterday's announcement is about protecting some of the most vulnerable people in our society. That we already know, anyone who's in hospital, in a hospital bed, they're there because they're vulnerable. They're already ill. There's already something that's making them, you know, ill and vulnerable. And the last thing you want to do is expose them to this horrible virus if it can be prevented. Now, I'm not pretending, nobody is, that you can have a 100% method of protecting them, but what you can do is reduce the chances of them becoming affected. And I think it is perfectly reasonable to say to everyone that works in health and care that you please take this vaccine. Some 93% have had at least one shot, and that's fantastic to see. There's still around 100,000, we estimate, in the NHS that have not. But over the coming months, we will work with them, the NHS will work with them in the most positive, constructive way to help them make that positive decision to take the vaccine.
Yeah, 37% chance is still pretty high, though, isn't it? Would it not be better?
Well, what would you like, Kay? Would you like a 100% chance?
I was just about to go on, if I may.
37% chance. You say it's quite high, but I'll tell you what, 80 and 90% chance is a lot higher. And I think your viewers listening to this program would understand that this is about minimizing the risk. It's about minimizing the risk. With this virus, it's a horrid virus. Sadly, we know so many people that have been affected. You may know, I know people. I've lost loved ones to this, but lots of people have listening to this program. And I think what they would expect, that if you are in a vulnerable situation, if you're in a hospital bed, you're in a care home, you're at your home receiving domiciliary care, they don't want to know that care worker that is perhaps visiting some 10 people that day, if they are infected and perhaps they're asymptomatic, do you want them going around every house and infecting 10 of their people that they're seeing them? Of course you don't. Your viewers don't want to see that. Now, I'm not saying it can be 100%.
If I can jump in at some stage and say, I was going to go on to say, why not
you
test
can, but
people?
I'm only doing what you normally do, but carry on.
If I may, I was going to say, why not test somebody every day if they're a frontline worker and then you're 100% sure that they haven't got the virus?
We do that anyway. The NHS will do that in I don't know if it's exactly every day, but in the NHS and in care homes, people will be tested regularly precisely for the reason that you pointed out earlier, that when you take vaccines, of course, your chance of being infectious is a lot less, but it's not foolproof. And that's why having the vaccine alongside regular testing is the best way that we can go and protect everyone in any way that we can.
You test people twice a week, I believe, in the NHS. Why not test them every day?
I think that it's about regular testing, and I leave that up to the clinicians to decide
not every day,
how.
though, is it?
I think the clinicians should decide how often people need to be tested and the types of tests that are taken. But I think as long as there is regular testing and people have taken the vaccine, and of course there are other controls in place in a hospital, other infection controls and measures, I think all of these taken together makes the conditions for those vulnerable people as safe as they possibly can be. And again, that's really at the heart of yesterday's announcement. It's all about patient safety. Of course, it will help protect other colleagues in the NHS and in care as well, because you don't want the staff to get ill if that can be avoided. And so this is what yesterday's announcement is about.
OK, what has Geoffrey Cox done wrong?
Look, I don't want to get into any individual case, especially if I don't know the details, but I know obviously the big issue that you're talking about, and I do think it is important that any member of Parliament, if they do have any external duties, that they are completely open and transparent about that. I think it is important that their constituents obviously know about that, and also that they engage in no kind of lobbying whatsoever.
OK, Labour's referring Sir Geoffrey Cox to the Standards Committee for a brazen breach of the rules. Do you want to defend him this morning?
As I said, I'm not going to get into an individual case. I don't know the individual circumstances of every member of Parliament. All I can say about Geoffrey Cox is my time in government with him when he was beside me as a cabinet minister. He was a fantastic cabinet minister. But in terms of these issues, I don't know the details.
OK, let me ask you more generally then. Do you feel comfortable with the rules as they presently stand on MPs having second jobs?
I think the rules as they currently are, in terms of having that flexibility, whether it's a consultancy type job, whether perhaps it's an MP that is still serving in some capacity as a doctor or a nurse, or I think it's a right that those rules allow that flexibility. But I think the most important thing really is that that MP, whoever he or she may be, is completely transparent and open, follows all the rules, and so that their constituents and the wider public know that they might have another interest. But also, I think it's important that they continue to spend the vast majority of their time on their parliamentary affairs and their constituency affairs.
OK. Should MPs be able to use their office for second job work?
No.
OK. So if they did, what should happen to them?
Well, look, you might be trying to draw me into some individual case, but if there are concerns, or
you said no, they shouldn't.
If someone believes for good reason that they might, then I think what they should do is ask the appropriate authorities to look into it, and they can get down to the facts.
Yeah,
but of course you shouldn't be using, whether it's your parliamentary office. Yeah, if it's your whether it's your parliamentary office or any other parliamentary stationery or anything that's funded or supported by the taxpayer, of course that should not be used. And again, I can't talk about any individual case. I think the rules on the use of whether it's parliamentary property or your letters or letterheads or stamps or anything like that, I think the rules are clear. And of course, all MPs would be expected to observe that at all times.
OK, I'm not talking about specific cases because you don't want to, but if somebody did use their office for a second job, what should happen to them?
Look, I don't know. It would depend on all the circumstances, and I'm not the judge of this, nor should I be. It should be independently judged by the Parliamentary Standards Commissioner. So if there are particular cases, then I would trust the Commissioner to look at that and come to the right decision.
OK, well, that's what Geoffrey Cox did, apparently, but you don't want to talk about specific cases. What I can talk to you about, though, is that the Vice-Chairman, Andrew Barry of the Conservative Party, has stepped down. He says he can't cope with all this sleaze anymore. Doesn't look great, does it, when that sort of thing happens?
Look, I don't know about that. You just shared that information with me. But I think, look, it's really important that parliamentarians, whichever party that they're in, that there are really clear, transparent rules, whether it's around lobbying, it's the use of parliamentary property, and that they are held to the very highest of standards.
It's frustrating for you, though, I'm sure, isn't it, given that if last week the Prime Minister had not forced all of you to support his mate, who subsequently had to step down because the British public are just not having it anymore, then, you know, you wouldn't be in this position, would you, as a party?
There was a case, a particular case. In that case, it was the Owen Paterson case. And look, I voted for that motion. I do regret it because I think it was wrong for me to conflate the Owen Paterson case with the right of an appeal. I do think it's important for parliamentarians on a cross-party basis to think about how they might always be able to improve a system. But it was wrong to conflate it with Owen Paterson. So I regret having voted for that. I'm glad it's something that is settled now, as in I believe yesterday the government has brought forward a motion to rescind that and to accept the Owen Paterson report in full, and I think that's the right thing.
OK, final question before I let you go. Back to on topic for you. I'm reading in the newspaper this morning that over 65s in France will not be allowed access to restaurants, on trains, etc., unless they've had their booster. Is that something that you might look at?
We're not looking at that yet. You're very focused on our booster program, as you would imagine, over 10.6 million boosts, I think, throughout the UK so far already, a record number of bookings, many people coming forward. I think in due course, we will have to look at what constitutes vaccination. But at this point, the most important thing is that anyone that's eligible gets out there and gets their boost.
OK, you said yet, so potentially in the future.
I can't rule that out, and I think that we know now that the vaccines do wane, and it is important that those vaccines, where it's necessary, that those people get a top-up, and that's what the booster program is about. But I think it's something that we have to keep under review.
OK. That was a bit spiky of us both today, wasn't it? I don't know what's going to happen in your next interview,
spiky.
but I must let you go.
You like spiky.
I do, actually. It's because I'm a Wigan street fighter. It's good to talk to you. Thanks very much indeed for joining us. Thank you.
Goodbye. Goodbye.
Bye-bye. Ooh, he had 3 Weetabix this morning, didn't he? David Nabarro is joining us from the World Health Organization. Hello to you, Dr. Nabarro, forgive me. Good morning. Lovely to see you. Over 65s should be forced to have a jab. What do you think?
Yes, I was listening to your interaction with the UK minister, and I thought, what a tough job he has, because on the one hand, you do want to try to get as many people as possible protected if you're relying on vaccines primarily to get this pandemic under control. But at the same time, there are a lot of people who, for genuine reasons, don't want to be vaccinated, and it creates a terrible conundrum for you. So, yes, I know about the shift in rules in France and the change in the structure of the sanitary pass, as it's called, I just hope that governments can achieve their objectives without putting really tough requirements onto people that then will turn them against their governments, because this is going to go on for years, this COVID pandemic. It's not going to suddenly stop. I hope it does, but I don't think it will. And we all need to be able to tolerate and cooperate with each other without actually having to have rigid instructions or what's called these vaccine mandates like you were just discussing. So I'm going to stay absolutely on the fence on this and say, please, don't get to the point where you have to put really tough restrictions that just make people feel really frustrated, because we've got to do this in partnership.
Doesn't sound as though you're sitting on the fence, Doctor, if I'm honest. It sounds as though you're suggesting that people shouldn't be forced to have a jab.
Within the World Health Organization, we've generally said don't force people. But at the same time, we've also said that we can't take on government policy on behalf of individual governments. And we do recognize that each government has to try to work out what's right in their own circumstance. That is, it's sitting on the fence, I suppose. But yes, I'm going to tell you that I personally am really trying my best to get across to people that forcing folk into particular positions through various coercive measures is a really last resort. I mean, when I've done any infectious disease control effort, the thing that I've learned is that people are the solution. They're not the problem. And so therefore partnership between government and people is critical. It's really difficult when then issues get split along party lines and cooperation gets so much harder. And perhaps that's the toughest thing about COVID, is that the responses get politicized. In some places, if you wear a mask, you're thought to belong to a particular political party. And that's the most regretful thing about the present situation. We all need to be able to do what we've got to do, regardless of what politics we adopt.
What more should we be doing in the UK to try to stem COVID-19 and its transmission? We saw our Prime Minister in a hospital earlier this week, and he didn't have a mask on. He doesn't have to wear it in a corridor. He just, and this was a corridor where he was meeting people. You just need to wear a mask in a clinical setting. But we've spoken previously about how important it is to wear a mask. Do you still abide by that?
I'm not sitting on the fence on this one, Kay. Where you've got large amounts of virus being transmitted, everybody should do everything to avoid either getting the virus or inadvertently passing it on. And we know that wearing a face mask reduces the risk. We know that maintaining physical distance reduces the risk. We know that hygiene, regular hand washing and coughing into your elbow reduces the risk. We should do it all, and we should not rely on any one intervention like vaccination on its own. So yes, 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 please, would every leader be wearing face masks, particularly when in indoor settings? And could everybody please be face masked if they possibly can when they're up close and personal with other people, and especially in non-ventilated environments? This virus is unforgiving, and we need to do everything possible to prevent it getting in between us and affecting us.
And as far as travel is concerned, we know that we can fly to the United States again as of yesterday. Are you going to be flying here to see those lovely grandchildren anytime soon?
Well, I did go and see my grandchildren over the weekend, and I said to Otto, who's the one that we've discussed a few times, that he's often discussed between us. He didn't exactly reply because he's not talking yet. I got a picture, but I don't think I'll waste your time trying to show you. But he's in very, very good form. Yeah, too difficult. But I have to say, Kay, that I'm not traveling very much. Why am I not traveling very much? Because I don't want to get COVID. I'm in the wrong age group, and I've got all the adverse factors as well. And so I'm trying to say to everybody, travel if you must. And there are often essential emotional reasons as well as essential economic and other reasons. But try not to travel if you don't have to, because traveling does increase your risk. We know that the more contact you have with other people, the more likely you are to both get the virus and to spread it. So minimize travel, please. And I'm asking everybody, if they're organizing meetings, make sure they're either virtual or hybrid, so that if people are unable to travel, they can still participate fully from a distance.
OK, it's good to talk to you, Doctor. Thank you very much indeed for joining us, as always.
Thank you.
Thank you
very
Dr.
much.
David Lloyd is with us now. Hello to you, Dr. Lloyd. Where are you on masks and travel?
Oh, I'm totally in favour of masks. The data is very strong that it is the number one thing to prevent transmission. And there are 1.5 million people in the UK actually actively with COVID at the moment. So you don't know who you're going to meet, who's going to have it.
What about Prime Ministers walking around hospitals without one on?
Well, I did just see that on your clip just before I came on. I was aghast. I mean, goodness, he's broken all the rules. We still have to wear masks. Yeah, no, it's somebody didn't have a word with him there, I think.
He rolled his sleeves up, tucked his tie in, forgot his mask.
Exactly. I mean, there was a complete own goal. Extraordinary.
Talk to me. You said, did you say 1.5 million people have got COVID at the moment?
Yes, the data I've just looked at. So there are 1.5 million active cases in the UK at the moment. So numbers are down, but deaths are going up, and 1.5 million people are coughing and spluttering and have lost their sense of taste and smell. So that's what the reality is at the moment.
So people need to have jabs, they need to have their booster. But I was chatting to the Health Secretary, I don't know if you heard him earlier on in the programme, and he was saying if you don't have, if you're not fully vaccinated, you're going to lose your job as part of the NHS. Are you completely behind him saying that?
I'm afraid I am. I've had very strong views about this for a very long time. I really think the NHS and social care should set an example. And it should be compulsory vaccination for everybody who works in the healthcare sector who are patient-facing. I can relax a little if you're never going to meet a patient. But honestly, as a patient, if you're coming into a health setting, you should expect to be safe. And one of the things we've got to do is to make sure that everywhere we go, in general practice, in hospitals, it is safe for patients, because that was a mistake we made at the very beginning. Do you remember how the first cases were actually picked up in hospital? So we can't have that again.
And as far as booster jabs are concerned, from the front line, how's that going?
It's doing very well. I think the people who are eligible for the booster jabs are the ones that are most at risk. So they're very keen to get their vaccines, and the vaccine centres are working very hard to give it. And we're stepping up our home visiting so we can get to the very frail and the elderly and give them their booster doses too. So yes, it's going all right where I am. Yes.
And I know the answer to this question, but a lot of our viewers won't, and it's always best to come from the doctor. Can you have your flu vaccine and your booster at the same time?
You can have it at the same time. You can have it an hour apart, a day apart, a week apart. So yes, they're not live vaccines, so they mix at any time.
Okay. And as far as the booster is concerned, if you need to have it, you already have been called and that's being rolled out. But what about on a yearly basis? Do we have any clearer idea yet whether we're going to have another one next year?
Well, you know way more about this than I do, Kay. You speak to all the guys and girls who are in charge of these things. But if I had to put some money on it, I'd say we're going to have it every year like a flu jab, so that we just have to get protected against COVID, just like we get protected against the flu viruses. And I haven't seen a flu yet. I don't know. I'm just waiting for my first flu, but I haven't seen any yet, which is interesting.
Okay. It's good to talk to you. As always, Doctor, thank you so much for joining us on the programme this morning. Dr. David Lloyd, thank you.
Bye.
Always the voice of reason. Now, also making the news for you this morning, Sky News has learned the man who injured himself and was stuck in a Brecon Beacons cave is George Linnane. He's said to be doing remarkably well in hospital after being rescued on Monday evening. Rescuers spent more than 50 hours getting him out of the cave after he fell 250 metres. That's a long way, isn't it? Goodness. The Supreme Court will rule this morning on claims the internet firm Google illegally gathered the data of millions of iPhone users in the UK. The company is alleged to have bypassed the default privacy settings on Apple phones and tracked people's online activity. Naughty. Scientists have discovered what they believe was the first dinosaur that lived on Greenland 214 million years ago. Unofficially now named Cold Bone, it was medium-sized herbivore with a long neck. While its remains were first discovered in 1994, it was only recently that researchers realised it was an entirely new species. More incredible pictures have emerged overnight from the huge volcano on the Canary Islands. Here we go. Lava from Cumbre Vieja volcano has again reached into the sea, where it cools and forms new land for the island of La Palma. It's nearly 50 days since the first eruption. Scientists say nearly 2,500 acres of land on the island has so far been destroyed. Dramatic pictures. Duke of Sussex has claimed he warned the boss of Twitter that the social media platform was allowing a coup to be staged just hours before protesters stormed the US Capitol building earlier this year. Let's find out more about it. Should we end standing by in the newsroom for us this morning? Mystic Meghan's husband then, knew all about it.
He did, Kay, yeah. Harry's version of events, he says that the night before the Capitol riots, January the 6th of this year, January the 5th, he was emailing Jack Dorsey, Twitter chief exec, and Harry says that he flagged up to him that this was going to happen. Now, Harry has been speaking as part of a panel discussion via a video chat, all part of Wired's Rewired conference, and he was speaking about issues relating to misinformation online and social media hatred. Have a listen to what the Prince said.
Jack and I were emailing each other prior to January the 6th, where I warned him that his platform was allowing a coup to be staged. That email was sent the day before, and then it happened, and I haven't heard from him since.
Now, Meghan has also been speaking. She has been in New York City as part of a panel discussion on gender pay disparity. Now, paid parental leave in the United States is not mandatory, and the Duchess believes that it should be. This is what she had to say.
I don't see this as a political issue, frankly. Look, there's certainly a precedent amongst my husband's family and the royal family of not having any involvement in politics, but I think this is, paid leave, from my standpoint, is just a humanitarian issue.
Okay, both of these appearances come just 2 weeks after a data analytics firm revealed that 70% of all the online abuse Meghan and Harry have suffered in the past few years has come from just 55 accounts.
OK, thanks very much. Fans of one of the most popular series on Netflix are about to get even more gore. Here we go. Squid Game is estimated to have been watched 111 don't look at me, million times since it was released in September. There will now be a second series of the show about adults who play children's games to the death in order to win a huge cash prize. In other words, it's being given the green light. We'll talk to the Secretary General of the Norwegian Refugee Council coming up, live from Tehran, as he attempts to help the hundreds of thousands of Afghan refugees who have fled there. Stay tuned. Hundreds of thousands of Afghan refugees are arriving in Iran as they flee the Taliban regime in Kabul. Officials in Tehran estimate around 4,000 cross the border every single day. Let's speak to Jan Egeland, Secretary General of the Norwegian Refugee Council, who is joining us live from Iran now. Hello to you, sir. Thank you for joining us again. How bad is it for Afghan refugees travelling across to Iran?
It's terrible, really. The collapse inside Afghanistan is so tremendous that hundreds of thousands have now amassed at the border to the neighboring countries and want to get out over. Here in Iran, thousands and thousands of exhausted, hungry people come across these informal border crossings because the border is officially closed to Iran, and they are fleeing hunger, starvation, horrific conditions, because there is no real aid operation now inside of Afghanistan. Because of the economic collapse, we cannot even transfer money to the banks inside of Afghanistan.
What does the future hold for these people who basically risked everything?
Well, the future is bleak, really. Remember, Iran has between 3.5 and 4 million Afghans already here who have come over the years of fighting and war and misery in Afghanistan. And to put it in context, Iran alone has more refugees than 35 European countries. There are more people coming over the border every day than are at the Polish border, which Europe is declaring as a continental crisis. So perhaps Europe should be a little bit more worried for these horrific root causes of the problem, which is the collapse of the economy inside Afghanistan, and there not being enough support for the neighboring countries than for the handful of thousands that are now coming to the border. There could be many more coming if there is not hope, an investment in hope in these areas where there are millions.
What is the Norwegian Refugee Council doing to try to help them? We just saw some footage of you there, so where you're going around looking at the conditions people are living in.
Well, we are trying to scale up dramatically inside Afghanistan, first and foremost. We need to give hope to people that they have a future in Afghanistan. And we need more money, we need the financial system to function, and we need a resumption of aid to the public sector there. So teachers and nurses and doctors, etc., that have been on the international payroll for decades and who have now been cut can get back on international support. That will do things a bit better in Afghanistan, we hope, and fewer will then give up and come here. Here in Iran, we're also trying to scale up more support, more shelter, more ability to integrate people within Iran. We're begging the Iranian authorities to keep the borders open, which Europe is not, by the way, so that desperate people can get shelter, can get some protection, can avoid starvation this winter.
Okay, it's good to talk to you. Doing amazing work as always, Jan Egeland. Thank you very much indeed for joining us. Thank you. Thank you. Quick look at the weather.